Do you have geriatric patients or geriatric pets? Would you like to know the best exercise that you can do with them? A great starting exercise that you can do with every geriatric patient you have, plus an exercise that you can use on so many of your patients? I'm Dr. Laurie McCauley from Optimum Pet Vitality, and today I'm going to go through one of my favorite starting foundation exercises. But we're going to talk a little bit about other things first. First thing I want to tell you is with this exercise, it's really awesome. You can use it for puppies, literally from the time that they can stand. We can help it with their proprioception, their balance, which will help them handle stress better when they get older. There's studies behind it. We can help with our neurological patients or patients with neurological problems, anything from disc disease, FCE, from ataxia from any cause, cerebellar disease, canine idiopathic vestibular syndrome, right? The guys that are like this and maybe nauseous and circling, we can help with those guys. We can use this exercise post-surgically, post-cruciate, hip issues, shoulder, elbow issues. It's wonderful. We can even use it in our athletes. What? Puppies to athletes? Wait for it. We'll get to it at the end, but yes, we can. It's a great exercise. Well, I said it's best for our geriatric patients, so let's talk about that for a minute. I want to introduce you to the term sarcopenia. Sarcopenia is a normal old age change. We can affect it, but it's something that's going to happen. As we get older, some of our muscle fibers will go from muscle fiber to fat. So we don't lose circumference, but we lose strength. Then they go from fat and other muscle fibers to fibrous tissue. So we lose both strength and circumference, which is why Arnold isn't as big as he used to be, even though he's working out, because of this old age change. So if we look here, look at this transection. This is a young, healthy person's thigh. This is the same size person as they have experienced sarcopenia. So what you see as black here is actually fat, and we see shrinkage of the muscle. And then there's fibrous tissue in there as well. If we look at this picture, this is a transection of the upper arm of a human. Again, a normal, healthy person, and there's some fat in there, but just with age, look how much more fat there is. If we think about, like, we see older people and they're like, oh, this is all wiggly. It's not going to happen to me. I'm going to keep my triceps strong. It's going to happen. We can slow it down, but it's going to happen. What else is happening with sarcopenia? We can see decrease in blood flow to the area. We can have more muscle stiffness. Oh, I'm slow to get up. We can see, here's our size difference, the loss of strength. Well, what happens? What causes this? There's a whole bunch of different causes for sarcopenia. Being sedentary increases, inflammation increases, body fat, right, which increases inflammation, increases hormonal changes, chronic disease, malnutrition, all kinds of things that we can look at, minimize, so we can slow this process down. Now let's talk about muscle fibers for a minute. So all muscles, except for one in racing greyhounds, is made up of a combination of type 1 and type 2 muscle fibers. Now, there's type 2C and type 2 dog. We're not going to talk about that. We're just going to keep it simple and general for right now. So if you think about someone who does marathon running, their muscles of running are going to be mostly type 1 fibers. If you look at a sprinter, someone who needs power and speed, I don't need to go for a long time, I just need to get there fast, I'm going to be mostly type 2 muscle fibers. Someone in the middle who's like, yeah, I'm going to do 5 or 10 miles, that's okay. They're going to be more type 1 and type 2 balanced. So what does this tell us? This tells us that we can actually change how these muscle fibers function and actually switch type 1 to type 2 or type 2 to type 1, depending upon the activity that we do, which is really cool because we can affect sarcopenia by knowing that and then using it appropriately. So let's learn about type 2 muscle fibers. Type 2 muscle fibers are our strength, our power. They're the ones that hypertrophy and get bigger. So like our gym rats, right? They're lots of power, go, 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 and then they fatigue. They're anaerobic, so we're using glycogen, which then we have to replace. And the important thing is as we get older, we lose them. Just from aging, we lose up to 25% of our type 2 muscle fibers. 25%, that's a lot. That's a quarter of them. Now let's look at our type 1 muscle fibers. That's our endurance. So we're going to go, go, go. It's not a lot of power, but we can just keep going and going. That's our lean muscle. That's slow to fire, but repetitive. That's aerobic. We're using fat, which is great. We burned through the glycogen, and now we're on to fat, which means we can do two things at one time. We can help decrease our fat and our inflammation from it, and increase our type 1 muscle fibers, strength, and change more of our type 2 fibers to type 1 fibers because we don't lose them with aging. Isn't that awesome? If we know that, we can use that. So we can help strengthen the dogs even as they're getting older. So how would we lose these muscle fibers? Disuse atrophy, which is why it's so important for our older animals, well, all of our animals, to just keep going, right? Get up and move, get up and move. Let's go for a walk. Let's go for a longer walk. Let's go for a shorter walk. Let's move so that we don't lose our type 1 muscle fibers. Our type 1 muscle fibers are our postural muscles. So they're much higher concentration in the muscles that help stabilize our joints, both in our spine and in our trunk. So they're super, super important. We don't want to lose them and then have our joints become more unstable, back or limbs, because that would increase our chance of injury and degenerative change. We don't need any more inflammation. We don't need any more arthritis. We want to be strong and healthy and have a great optimum life. So what's the exercise? Rhythmic stabilization. What? You say, Laurie, that is so easy. That's not really an exercise. Yes, it is. It is something that we can use to contract all of the muscles. We can use it to contract the rear limb muscles, the forelimb muscles, the trunk muscles, even the neck muscles are going to tighten as we do this exercise. So what are we doing? We're gently pushing and getting them to resist. And you say, well, okay, I pushed them. All right, we're done. No, we can push left to right at the back end, in the middle, at the shoulders. We're getting all of these muscles to contract. We're actually working the diagonals, right? So we're both diagonals, forward and back. We're pushing forward, we're pulling back. See, there we go, pulling back, and he's fighting me going forward. Now, it's really important that we tell them to stay so that they don't just step out. And it's very important that we think about where they're at and where we want them to be. So if they're shifting weight off of the leg and there's no pain, but we want to strengthen that leg, we want to shift them onto it, not off of it. If he's not putting weight on a right rear leg, we're not going to shift weight off of that. We're going to shift weight onto it. If he says, oh, my back end was sore, you got rid of the pain, and I'm still having my weight forward, we're not going to push him forward, but we are going to pull him back. And then we have something called carryover, which means that when we get done with these exercises, they're going to be more balanced. And when they walk off, they're going to be more balanced. So we're helping them long term, and we have to do it multiple times, but we're helping them long term, not just for the here and now, which is so, so cool. Okay, you say, well, Laurie, you said it would help with my neurological patients or my patients with neurological disease. Even before they can stand, we can have them in a sphinx position. So they can't be with their legs to the side, but if their front and rear legs are in proper position and we shift them, they can be pushing off, working their trunk and their limbs even before they can stand. We're slowing down or stopping atrophy while they're not able to support weight. Once they're able to do it in Sphinx, we can do it in tall sit. So now they're sitting and we're shifting in diagonals, left to right, front to back. So we're working trunk and all four limbs. And you say, okay, Laurie, all right, so we got puppies, that's going to help. We've got our ataxic dogs and our dogs with spinal issues. We have our geriatric pets. What about athletes? You said it can help with athletes. They need work with balance too. Imagine if you're standing on one foot, you can't see me, but I am, and someone pushes you. it's going to work your trunk. So we can do this either on, well, first flat surface, then an unstable surface, which could be a bed, a couch, a stabilized peanut ball, even a donut, which is really hard, and we can pick up a leg very gently so that we are not supporting them, but picking up and putting them on 3 legs and then doing the rhythmic stabilization would be like me having you pick up a leg and then doing rhythmic stabilization. It's a great exercise. And obviously we're not just going to do 1 leg. We're going to do it with all 4 so that they're balanced. Great foundation exercise. If you like my teaching, go to OptimumPetVitality.com and sign up for our newsletter. Now, if you're getting this video because you are getting the newsletter, you can go to OptimumPetVitality.com and click on the Learn and Go at the top, and that'll get you to other videos like this that you can scroll through and pick whichever topics you like. And you can watch them. Please, please, please share this with your friends and colleagues so that more people can learn and have better optimum quality of life for their dogs. All right. I'm Laurie McCauley with Optimum Pet Vitality. I hope you learned something. I hope you had fun, and I'll see you next time.